Cases of smallpox have recently been reported, and other suspected cases as well in our country. This week, we have conducted various interviews to better inform you, our people, on the outbreak. Over to you, Simon.
Thank you, Penelope. Here I am looking through the files of recent cases of smallpox. I am just waiting to hear from Dr. Kehoe about... I have some questions, and I will inform you, citizens. She'll be here momentarily to answer my questions. Doctor!
Yes,
we have some
what?
recent questions about some smallpox cases found in our local area.
Okay.
Excuse me, what is the symptoms that cause these things of the pox?
Well, first you'll notice a headache, maybe stomach aches, nausea, throwing up, fatigue.
I'm here to ask you some questions about this pathogen. Can you please explain this to us, of smallpox?
The smallpox infection is caused by the exposure to a virus called variola. It is a very rare and life-threatening disease.
Now, can you explain the symptoms to us?
At first, the patient will experience high fever, head and body aches, fatigue, malaise, upset stomach. The last symptom that patients will notice is a skin rash. They will experience blisters that are filled with pus, and eventually they will burst, scab, and then fall off. It's highly contagious when there is a fever of 101 degrees Fahrenheit or over. It's also very contagious when there's an onset of a rash. Once the scabs fall off, then the infected person is no longer contagious anymore.
Doctor, how is this pathogen transmitted?
It is transmitted through person-to-person contact, and it is also an airborne disease.
Doctor, how do we protect ourselves from this?
Well, we are coming out with vaccinations currently that everybody needs to get. I highly recommend it.
With the contaminated citizens right now?
Currently, we are keeping them in quarantine at the hospital, and we are also searching for a treatment as we speak.
I am here with the mayor of Seattle.
A vote for April Davidson is a vote for the cure of smallpox.
Hello, Mayor April Davidson. I have a question. How are you stopping this disease of smallpox from spreading around our city?
I really want to stress people to stay at home away from other infected people. And if you must go out, keep a mask on and avoid all contact with any other people.
Who will be the first ones to have access to this vaccination?
Weakened immune systems, pregnant women, children, and places that are very unsanitary.
Mayor, how do you feel about this?
I feel that this could turn into a very big epidemic soon if we and the town do not take the right precautions to stop it.
And Mayor, how are you protecting yourself?
I'm more concerned about the people than I am for myself.
Okay.
Vote for me.
Mayor, how long have you known about this outbreak?
I've only recently caught wind of this news, and I'm doing my best to prevent it before it becomes an epidemic in our town. Vote for April Davidson.
Thank you, Mayor April Davidson, for your time. Now over to you, Simon. Hi, Sanders Moore. I have a couple questions for you.
Okay.
Can you tell us about the life cycle of this virus?
Well, after the virus enters the body, it makes its way into the lungs and the lymph nodes. Once there, it starts the lytic cycle and begins to reproduce. On average, this takes about 10 to 12 days, and it is called the incubation period. At the end of the 12 days, the virus moves into the bloodstream. The body then mobilizes resources to defend against the virus, causing fevers, muscle pain, and stomach aches. In half of the cases, it also leads to vomiting, and in about 15% of the population, it causes fainting.
Yes,